Hey everyone, and welcome back to the channel. Today we're diving deep into a critical aspect of electrical safety in healthcare facilities, specifically Rule 24206 of the Canadian Electrical Code. This rule is all about isolated branch circuits in patient care areas, and it's something every biomedical technologist, hospital electrician, and clinical engineer needs to understand inside and out. We'll be focusing on a very specific and very important number, 5 milliamperes. So, what exactly does Rule 24206 say? In a nutshell, it governs the electrical systems designed to protect patients from potential electric shock, especially in areas like operating rooms or intensive care units. These are called isolated power systems. They're special because they aren't directly connected to ground like the outlets in your home. This isolation is a key safety feature. The rule states that when an isolated power system doesn't have a permanently connected line isolation monitor, or LIM, there are strict requirements for testing. This is the scenario we're focusing on today. Without a LIM constantly watching the system, we have to perform manual checks to ensure it's safe. The core of this requirement is the total hazard index. The code mandates that the total hazard index for an isolated branch circuit must not exceed 5 milliamperes. This is a hard limit, and it's there for a very good reason. Before we get into why that 5 Mate number is so crucial, let's clarify a few key terms. First, an isolated system. As I mentioned, this is an electrical system where the two main conductors are isolated from ground. Think of it as a floating power source. This design helps prevent a person from completing a circuit to ground if they touch a live wire, significantly reducing the risk of a major shock. Next up is the hazard index. This term refers to the total potential current that could flow from the isolated conductors to ground under fault conditions. It's essentially a measure of the system's leakage current. And finally, the total hazard index is the sum of the hazard index of the isolation transformer itself, plus the hazard currents from all the equipment plugged into that circuit. It's the cumulative risk of the entire setup. So, why the 5 milliampere limit? This number wasn't picked at random. It's directly related to preventing a specific and very dangerous type of electric shock called microshock. In a patient care environment, especially during invasive procedures, a patient might have a direct electrical path to their heart. This could be through a pacemaker lead, a saline-filled catheter, or other conductive medical devices. When such a direct path exists, even a tiny amount of current, far too small to feel on your skin, can be lethal. Currents as low as 10 to 20 microamperes, that's thousandths of a milliampere, can trigger ventricular fibrillation, a chaotic and life-threatening heart rhythm. The 5 May limit acts as a robust safety margin. While the threshold for microshock is in the microampere range, the total hazard current limit is set in milliamperes. This higher limit accounts for the entire system, the transformer, the wiring, and every single piece of medical equipment connected to it. By keeping the total potential leakage well below a level that could cause harm even in a worst-case single-fault scenario, the code ensures a high degree of patient safety. It's interesting to compare this with other international standards. For example, in the United States, NFPA 99 and NFPA 70, which is the National Electrical Code, have similar requirements for isolated power systems in what they call wet procedure locations. They also specify a total hazard current limit of 5 milliamperes for the complete system. This shows a global consensus on this safety threshold. The fundamental principles of electricity and human physiology don't change at the border, so it makes sense that the safety standards are aligned. Now, let's talk about the role of a line isolation monitor, or LIM. Most modern isolated power systems in hospitals do have a LIM. A LIM is a fantastic device that continuously monitors the total hazard index of the system in real time. It's a watchdog. If the total hazard current starts to creep up and approaches the alarm set point, which is typically set at 5 milliampere, it will trigger both an audible and a visual alarm. This immediate feedback is invaluable. It alerts clinical and technical staff that something is wrong. Maybe a piece of equipment is faulty or there's an issue with the wiring, long before it becomes a critical danger to the patient. The presence of a LIM provides continuous assurance that the system is operating safely. So, What does this all mean in practical terms for hospital staff? When a system doesn't have a limb, as per Rule 24-206, the responsibility falls on manual testing. This means biomedical or maintenance personnel must periodically connect test equipment to the isolated circuit and measure the total hazard index. This test is typically done with all the regularly used medical equipment plugged in and turned on to simulate a realistic operational load. If the measurement exceeds 5 nm, immediate action is required. This isn't a "we'll get to it later" situation. The first step is to identify the source of the high leakage. You start by unplugging devices one by one and retesting to see which piece of equipment is the culprit. Once the faulty device is found, it must be removed from service immediately and sent for repair or replacement. If the high leakage persists, even with all equipment unplugged, the issue might be with the isolation transformer or the wiring itself, which would require a qualified electrician to investigate. Regular documented testing and diligent maintenance are absolutely essential. It's the only way to ensure compliance and, more importantly, patient safety on these types of systems. Now, there is an interesting exception noted in the code. Rule 24-206-3 provides a bit of leeway for circuits that supply only a single piece of equipment. If an isolated circuit is dedicated to just one load, like a specific X-ray machine or a specialized surgical laser, the total hazard index limit doesn't apply in the same way. The logic here is that the risk is contained to that single device, and the leakage characteristics of that device are known and managed as part of its own safety certification and maintenance. However, this is a specific exception and doesn't apply to the general use receptacles you see in an operating room. It's also really important to make a distinction here. The 5 MA total hazard index for an isolated system is different from the general leakage current limits for individual medical devices in patient care areas. For example, a single piece of patient-connected equipment might have a chassis leakage current limit of, say, 100 or 300 microamperes under normal conditions. The 5 MEA limit is a system-level measurement for the entire isolated circuit, not a limit for a single device. It's the sum of everything contributing to the hazard. So, to wrap things up, the 5 mA total hazard index limit in Canadian Electrical Code Rule 24-206 is a cornerstone of electrical safety in critical patient care areas. It's a system-level defense designed to protect the most vulnerable patients from the risk of microshock. Whether it's monitored continuously by a limb or verified through regular manual testing, adhering to this limit is non-negotiable. It represents a critical layer of protection that accounts for the cumulative leakage currents of the entire isolated power system. Understanding this rule, its definitions, and its practical implications is vital for anyone working to maintain a safe healthcare environment. Thanks so much for watching. I hope this deep dive into CEC 24-206 was helpful. If you found this information valuable, please give this video a thumbs up and consider subscribing for more content on healthcare technology and safety. If you have any questions, drop them in the comments below. Stay safe out there, and I'll see you in the next one.